187,802 people over the age of 65 have completed their COVID-19 vaccine in Minnesota. Reported by the Minnesota Department of Health, directed by Jan Malcolm since 2018, in the Minnesota COVID-19 Response Vaccine Data by Age, updated February 2021. All of us currently attend a public school, and some of us may be continuing our education next year at a public school for college. Students should not be required to get the COVID-19 vaccine in order to attend public schools. First, I will talk about reasons why students should not have to be vaccinated. Second, I will talk about the unknowns of the COVID-19 vaccine. And lastly, I will talk about negative effects this policy may have on the school. First, let's look at a couple reasons why students should not have to be vaccinated. Many elderly are struggling to get the COVID-19 vaccine. This virus is obviously very high risk, and their symptoms are going to be very high compared to ours. They need this vaccine more than we do, and so we need to make sure they're getting it before any public school student is even think about getting this vaccine. Their mental health is also declining due to this pandemic. Gabrielle Martens van Jaarsveld, an expert in the Department of Psychology in the Netherlands, states in an article on the Frontiers of Psychiatry published in November 2020 that there is a rise in anxiety and depression in those facing extended lockdowns. This is magnified in the elderly population due to higher threat of illness, loss of social support, and stricter lockdowns. Many elderly are staying in their house or being forced to stay in nursing homes because of this pandemic. They are not having quality time with their family and friends, and it's a lot harder for them to socialize than it is for us because we have social media, and a lot of elderly do not have that privilege that we do. The effects of COVID-19 on teens are also very minimal. I'm not saying that if we get this virus, it's not going to be bad because it is dangerous, but we need to think about the elderly before we think about ourselves. According to the CDC, the National Center for Health Statistics, in the report titled Provisional Death Counts for COVID-19, updated in February 2021, that in ages 0 through 29, there have been 1,888 deaths due to COVID-19 alone, while in ages 50 through 84, there have been 307,168. How can we think that vaccinating all public school students needs to be done before obviously all this elderly need this way more than we do? I just talked about reasons students should not have to be vaccinated. Now let's talk about the unknowns of the COVID-19 vaccine. There are a lot of unknowns when it comes to the COVID-19 vaccine, and that is something that can be scary to a lot of people. And not just the COVID-19 vaccine, and any vaccine in general, that can be scary. We don't know any of the long-term effects, and we won't know these effects until we get to the long term. We also don't know if this vaccine will affect teens differently than it will affect adults. Dr. Kristen Oliver, a childhood vaccine expert and a pediatrician at the Icahn School of Medicine, said in an article in the Center of Health Journalism published in October 2020 that their psychology is different and there's a lot going on in terms of development, so both efficiency and safety risks are different when it comes to children. How can we rationalize vaccinating all public school students when we don't know if this will affect teens differently than it will affect adults? More research needs to be done before we vaccinate all public school students. I just talked about the unknowns of the COVID-19 vaccine, and now let's talk about negative effects this policy could have on a school. This could have a lot of negative effects when it comes to public schools. Enrollment in public schools could go down due to parents pulling their kids from public schools. If they feel this decision is being forced on them by the school, they might not want to get their child vaccinated. Each family has different views when it comes to the COVID-19 vaccine and the virus in general, and schools need to respect that and not force this on families. They could also receive a lot of negative backlash. Parents could be very angry that this is being forced on them, and they might feel like they have no option when it comes to vaccinating their own child. This is something I think that should wait to go into effect. James D. Campbell, a pediatric infectious disease specialist, states in an article on Healthy Children, published in February 2021, that it may be possible for there to be a vaccine for some ages before the 2021-2022 school year. This is something that there should be no rush put on it, and we should make sure there's more research before we think about doing this. First, I talked about reasons why public school students should not have to be vaccinated. Then I talked about the unknowns of the COVID-19 vaccine. And lastly, I talked about negative effects this policy could have on a school. Students should not be required to get the COVID-19 vaccine in order to attend a public school. With the small amount of elderly being vaccinated in Minnesota, public school students being vaccinated should be the least of our concerns.